Hello, my viewers. Welcome to KhimHealth channel. And today we want to see the truth about getting pregnant after the age of 40. Because I see this question more often. People asking, Doctor, can I get pregnant? They ask me with those worried eyes, especially women above 40 years. And my answer is yes. You can still get pregnant, but it comes with caution and some risk associated to it. Your body changes over time always, and medically, the risk increases naturally. Let me explain this clearly. When a woman always turns 40, her egg quality begins declining. That's a biological truth, medically proven. But that age, fertility always drops. Only a few eggs remain active, and the remaining ones age 2. They may have DNA damage, and this causes pregnancy difficulties and sometimes miscarriages or even chromosomal abnormalities in babies. Such kind of abnormalities, most common is Down syndrome and Edwards or plateau. In most cases, I've seen women trying naturally. Some succeed, some face heartbreaks. By 40, success rate is low. Around 5% conceive naturally. That is medical data, and that is not fear. As a medic, I emphasize screening, early planning, and make huge differences. We check hormone levels always first, especially estrogen and progesterone balance. Low hormone can cause miscarriages. We also check thyroid function and thyroid status because thyroid affects fertility deeply. When level fluctuates, conception struggles begin. And irrespective of that, correcting it helps pregnancies, stability greatly. Everybody needs balance first. Now let's talk about pregnancy itself. Once you conceive after 40, you enter a high risk pregnancy category. Not to scare you, truly, just to prepare your mindset and what you're about to face. Blood pressure rises more easily. That's when preeclampsia can appear. It is a serious condition, ladies. It causes high pressure and swelling, sometimes even liver or kidney damage. Gestation diabetes also become common because the body resists insulin. Sugar levels rises beyond normal. That can affect baby's growth. We call that macrosomia or large babies, which is always associated with larger babies complication when it comes to vaginal delivery. And that will call for a C-section for it to be safer. But recovery takes longer periods at this age. It is a tough but manageable phase. We always support mother through every step of the way. Another thing I always encounter and see often is placenta problems with old mothers or older mothers. Placenta may attach too low or detach too early suddenly. In both, uh, in both cause severe bleeding risk. Sometimes babies become too early, and that is what we call preterm delivery medically. Before that 7-week of gestation, baby's lungs and organs are immature. They often need incubation support. Sometimes babies don't grow well inside, a term we call intrauterine growth restriction, or IUGR in full. It happens when the placenta weakens early, baby receives less oxygen and nutrients. That's why we always monitor closely. Sometimes ultrasound helps track growth progress. Every 2 weeks is necessary because small signs saves big problems. That's the truth I have learned, and you learn when you're planning to get pregnant or planning to have a child at the age of 40 and above. Many ask about genetics. Will my baby be okay? And answer truthfully each time is there are some risks associated with that. Risk rise with maternal age, but yes, your baby might be okay. But medically or medicine has advanced wonderfully now. Early genetics screening are done through IVF or blood testing methods to check chromosomal normality and their safety. This always prevents Down syndrome and other complications. Science gives mother new hope again. I have seen healthy babies born to strong mothers in their 40s with good care and patience and constant medical supervision throughout the gestation period. And miracles still happen every day. So here is my honest advice. If you are over 40 now and you desire to conceive, start with medical consultation. Get evaluation, prepared, and be guided properly. Check your sugar, thyroid, and blood pressure status. Evaluate uterus status and ovarian reserve. Get your partner checks too. Fertility involves both partners equally. It is a teamwork from the beginning. Early healthy, rest well, hydrate, eat healthy, reduce caffeine, alcohol, processed food, and always take folic acid and vitamins to keep always stress levels under control, and your body listen to your mind always. Pregnancy after 40 is a brave move. It is not impossible, just that it is demanding. With right care, it's beautiful. You deserve safe motherhood always. Trust the process and science. I have delivered babies for quite a while, some from women aged 45 and above. Every case is unique and special. It requires patience and positivity. And faith is your own strength. So, my dear KhimHealth viewers, don't fear age, prepare wisely. Don't rush, plan with guidance. Your dream is still achievable truly. You can still get your baby, and you can also deliver a healthy baby as well. This is my take and my advice to you. Always listen to your body first, then let science work and walk beside you. Together we can create miracles. That's the truth, medically and humanly. So don't fear, just plan wisely. So if this video has impacted you or you have just learned something, consider subscribing to my KhimHealth channel for more health and educational video like this. Hit the comment section and share your views and maybe what you have gone through if you manage to get baby at the age of 40. So stay tuned up until we meet on our next video. Stay healthy.